So today, I'm going to show you how to use a metered dose inhaler, which, if some of you know, it can be used for asthma. I don't know if you've ever heard of asthma, but it's a very common condition that happens in kids and adults, and it happens with bronchospasms in your lungs. So one of the common medications that is prescribed for asthma is a bronchodilator. And those are sometimes called albuterol, Ventolin, Provenil. Those are the same thing as albuterol, but those are some of the most common medications given. So I'm going to show you how to use one today. We're going to start by showing you an aero chamber, which is one of these. It looks like this. It has a spot right here that you can put the MDI in. You'll just insert it there. Right here, take this off. You have a mouthpiece, which you will then make a tight seal with your lips there. And I don't know if you can see it, but there is a one-way valve in right there, actually. And you have to take a big deep breath in to open the one-way valve in order to dispense the medication into your lungs. So this basically just helps with proper distribution of the medication. Most of the time they give it to everybody to use it because it works really good. Better than just using a regular inhaler straight to your lips. So this is an inhaler. This is the box it comes in. This is Ventolin, which is albuterol. It's just a generic name for it. And it's called Ventolin HFA, which means hydrofluoroalkane. It's just a type of medication. And it looks like this. Take this off. You have the mouthpiece. This comes out. This is the canister. The medicine is in this. There's a counter on it. It says 204. And each prescription is different. It varies on how many dosages are on it. This particular prescription is for 200 metered inhalations. So there's always going to be 4 extra because you have to prime the canister in order to get the medication right. So how you do that is simply just take this off. Make sure that the medication is properly in. And you're just going to give it 4 puffs. So you just press the medication actually down, and there's a spring in there, and there's a spring in here that will dispense the medication. So we're going to do this. 1, 2, 3, 4. So now, if you look on the counter, it will say 200. And whenever you do it, you should see the medication actually disperse outward. So now the medication is ready to be used. So now we're going to grab this aero chamber, take off the cap, insert into the aero chamber, take this cap off, and now we're going to instruct our patient on how to use this medication. But I don't have a patient, as you can see. This is one of the most common things that as respiratory therapists we will do in the hospital is proper education on treatments and stuff like that. So you want to instruct your patient on how to do it properly, because eventually, most of the time, asthma patients are going to go home and do this. So you want them to know how to do their medications. And we don't want to have to worry about them, doing it wrong and stuff like that. So you're going to instruct your patient, they can stand up straight, sit down with their feet need to be flat on the floor. And then you want to make a tight seal around this mouthpiece, which I'm not going to actually do it. You're going to make a tight seal around this. And since there's a one-way valve in this chamber, you can disperse the medication into the chamber. And it won't go anywhere until you suck in like that and the one-way valve opens. Then you disperse the medication. And if you do it too fast, this instrument actually whistles. And that's when you know that you're taking a breath that is too fast and too hard. So you don't want to do that. You don't want to hear the whistle at all. So we always tell our patients that. And if you do hear the whistle, all you have to do is just slow it down a little bit. And most of the times you have prescriptions for 2 puffs or 4 puffs, once or twice a day. So whenever the patient gets ready to do their treatment, we tell them, you're going to hold it like this. You're going to blow all your air out. So you're going to go put the air chamber to your lips, like I said, a tight seal. You're going to press the inhaler down, press it, and then as you press it, you're going to go suck in, and you're going to hold for 6 to 10 seconds, or as long as you can. You want the medication to get in your cheeks and go into your lungs, so you want to hold it. So you're going to do that, press the medication, and then let it all out. And by holding it, there should be none that comes out of your medication that comes out of your mouth. It should go into your lungs. So that's called like deposition of particles. And you want to ensure that you have proper deposition of particles. That will actually reach your lungs and they will dilate your bronchioles to open your airways up. Because with asthma, one of the breath sounds that you hear with a stethoscope is wheezing, which actually makes a wheezing noise. And with wheezing, you have bronchoconstriction. So your bronchioles are closed up. And air is not moving very well. So that's why we use a bronchodilator, because it dilates your bronchioles. And like I said, albuterol is one of the most common ones used with asthma. Inhalers can be used with other diseases too, but asthma is a very common one. So after you do your first inhale, you will take the inhaler out, shake it up. You want to shake it to remix the medication. Since you've already primed it, you only prime it whenever you get the inhaler. So you will shake it after a use, put it back, blow all your air out, press your medication, open the one-way valve, hold it, and then let it out. So hopefully your patient will start to feel better after they do this treatment. You want to listen to breath sounds afterwards. Make sure that if they still have wheezing, that it hasn't gotten any worse. Sometimes it can actually occur that wheezing is still audible. But with that, sometimes they have increased air movement because you have opened them up. So wheezing is very possible, but it's very rare. So like I said, this is how you do an MDI. Thanks for coming. Thanks for watching.